Hi everyone, I am Dr. Narendrakumar from Chennai going to explain tongue tie release. It's a very simple procedure usually done in the infants for the difficulty in breastfeeding or from the adults for the development of the speech. Preoperatively, the tongue tie assessment can be done by mop tip, Meo and the Kutlas test. But the classification of the Ankyloglossia is done by the tongue range of motion ratio, it is TRMR. There are 4 grades in it. So grade 4 is the maximum and we have to go for the surgical correction in it. My patient here is a 8-year-old pediatric child whose TRMR grade is 4. You can able to see this bilobed or angular tip of the tongue tip here. So we planned for tongue tie release of this patient, which is also called as frenulectomy or ankyloglossia release. The patient is taken in local anesthesia, 0.5 cc of 2% lignocaine is given. We have to choose a patient who is cooperative for the local anesthesia. So initially after the infiltration, we started with the mucosal dissection of the frenulum. So we have to make sure it is we have to done in a avascular plane and make sure which there should not be any duct injuries which the salivary duct injury opens and this the lowermost part of the frenulum. So we have to take care of it. The advantage is local anesthesia. You can see, you can check whether we have reached the appropriate dissection or not. So most important is after the mucosal dissection, we have to go for the muscle dissection. That is a fibrous gland which is in the middle of the frenulum. We can palpate it also. Make sure that we have to cut this fibrous band also in the middle. So then only appropriate protrusion of the tongue will be reached in this tongue tie release. So at the end, we have to see this triangular shape of the surgical field. You can able to see here. So after that, using the 3-0 cat, just we can put the sutures. If the surgery is done in the infant, as soon as the surgery is over, the infant can be go for the breastfeeding as early as possible, no problem in it. In utero, the growth of the tongue is guided by the lingual frenulum. During fetal development, the lingual frenulum functions to create a balance between the tongue, lip muscles and growing facial bones. After birth, as the tongue muscles lengthen, the lingual frenulum reacts and becomes thin. In some cases, the lingual frenulum fails to recede, tethering the tongue to the floor of the mouth. This results in ankyloglossia, we usually commonly called as tongue tie. So this surgery helps this boy in development of his speech difficulties. Some of the specific words which is not fluent for him can be corrected after this surgery along with the speech therapies. So post-operatively, jelly lignocaine jelly is kept to avoid post-operative pain. On table itself, we can see his protrusion of the tongue is maximum. This bilobed tongue tip is gone. So this is the first POD of this patient. To conclude, this is a pre-op and post-op of this patient. Thank you all for watching. Thank you.